So every project matters. And remember, I showed you this picture before about Chicago. What I realized when I was talking to grocers is they like this picture better. So our pictures matter, but both pictures are, oops, this is going by itself. Both pictures are true. There's truth in both pictures. Food desert, food oasis, right? Dichotomy, there's a lot of stuff in between. We worked with Mayor Daley in Chicago on a grocer expo, and the CEOs of Super Value, Kroger, and Roundy's came, as well as there were a couple hundred people. This was back when the grocers were still pretty nervous about the term food desert, and actually I raised all the money for this expo, and raised the money for a private dinner with the mayor, and signed confidentiality agreements with each of those CEOs, their companies, so that they could have dinner with me, in case they told me their secrets, which they, you know, I like this kind of ice cream, or that, you know, I mean, there weren't a lot of secrets at dinner. But since then, we've had real, productive relationships, and we actually had a grocer open not that long after in one of these food desert sites, and we went, so all the little green dots measures the impact. So that's what I encourage you all to do too, is measure your impact. So when that store in Chester moves in, measure, you know, the number of blocks and impacts, and look at the number of blocks here. You can read, so I'm not going to read them for you, but quite a few, a number of children. So I went back to that store just with my smartphone. We do a lot of documentation out in the field with smartphones. And I didn't plan this, but I saw a woman out there, and I was asking her about her experience, and here's what she said.
So they put everything so far away that the community didn't have the choice but to go to these small stores, corner stores, and they're way too expensive.
Can you find fruits and vegetables there at those corner stores?
Okay, so that gives you a little bit of an idea. You know, and our work is very empirical, block by block, but we do like to go out and talk to people and so on. So we work with the city to identify 6 priority sites for grocers, kind of like maybe in some of your work you're identifying high impact sites. And we found that that was something that the grocers could really handle, rather than saying there's 600,000 people in the food desert, which was a little overwhelming, I think, for everybody. And we actually came up with data to drive that. I had asked the mayor to use, you know Chicago, and I was confessing out Illinois. I went to a hunger symposium. I was one of the speakers in Illinois, and Rob Blagojevich was supposed to be the keynote, but he got arrested that day. And no one really skipped a beat, they just found somebody else. So I have to tone down my jokes about, you know, politics other places. But, you know, we were trying to figure out, like, how can we not politicize this, right? There's a lot of politics. There's a lot of politics that go into resource allocation. Did you guys ever know that? But anyway, so you can check on our website if you still can't sleep after reading the other stuff, that some of the access scores for these sites. But I want to share with you a new metric that we came up with, because we also found that talking to grocers about years of life lost, and some other people too, made them very sad. And I had, you know, there's only so many times you can bring out the hamster with the cookie crumbs to get over that. So we realized, instead of talking about years of life lost, we could talk about years of life gained, and kind of be proactive about the impact of what a mainstream solution could do. And again, it doesn't have to be a major player chain. It could be other kinds of solutions that maybe you're working on. So what would the years of life gain be rather than loss? And we work a lot with our, this is our former Chicago Health Commissioner. We have a new one now. We're working with him too. But I'm also head of the National Center for Public Research, and we had National Food Desert Awareness Month each September. And this last September, you know what we did? We retired the campaign, because I think if everyone's heard the term food desert, we have awareness. Now we're focusing more on food balance. But so he went out to help us pass out 1,000 pink pearl apples in a community where it's hard to find a decent apple. And in that community, that's where one of the targeted sites is, in that community. And do you know, if with life gained, if that mainstream store moves in, and all of these 6 sites have stuff going on now, including this one, there's a grocery store in the works. It takes, unfortunately, too long. But once that solution gets going and is open, it would impact 24,000 people, and it would collectively reduce with life gained liver disease by 13 years, you know, after you control for the other things, right? There's other things that contribute to liver disease. But 13 years, 15 years diabetes, 58 collective years of cancer, cardiovascular disease by 112 years. So, so every project matters. And actually in Chicago, since we started doing this, we did our original report in 2006, we did an update in 2008, the food desert population was reduced by 23,000, then in 2010 by 58,000, and now in 2011 by 166,000. And we have a lot of people working on this, a lot of different solutions, big and small. We've reduced the food desert population by almost 250,000 people. So that's a lot of people. But you know what? We have a way to go, and interestingly, we have a new administration in Chicago. I don't know if you guys, it's kind of hard to keep up with who's mayor everywhere, blah, blah. Have you heard of this guy, Rahm Emanuel? I don't know if you've heard of him. So right around the time before the election started, and before Mayor Daley said he wasn't running and things like that, I had actually gone to the city, some of the key people, not to the mayor, and said, hey, we should set a date for when we eliminate food deserts. And I got a lot of pushback, like, hey, we can't control this, we can't control that. What does Rahm Emanuel do, you know, fighting Rahm? Says, you know, hey, I'm going to tell the grocers what time of day it is, you know, we're going to eliminate. So the city has actually set a goal. I don't know who will be mayor then, but maybe him. Maybe he might be, I don't know. Well, I don't do the political thing, so I don't know. But it is really interesting that they've set goals to reduce and eliminate the food desert. And I was just at a summit with the health commissioner, and they have slides and everything, and when they're gonna, you know, and I'm telling you, they're working on it. So it's cool. But nonetheless, we still have some, you know, we have disproportion, right, with who's in the food desert. And also, you know, we still have quite a number of people left to worry about. And in fact, has anyone ever heard of Whitney Young High School? It's where the First Lady went to high school. You could fill Whitney Young High School to capacity 50 times with all the food desert residents. So that's how many people we still have, and this is kind of how the numbers shake out. So we're not done yet. We need to look forward and also track our progress and see how we measure up. By the way, we were talking about height and weight earlier, right, BMI. We did a study, we can't say where we did it because it's not a public report, but we did a study with school data, individual level data of children, height and weight, and did, you know, all the statistics, and found that in this particular area that children were, I'll just put it bluntly, children were shorter and fatter based on their, remarkably, based on, and at statistically significant rates based on their food environment. So remember we talked earlier about children are the biggest cohort, the biggest group that really needs help. And you know, we don't want to come up short on that. And you know, don't we all work on some of these issues with height and weight and, you know, children and you know, are all different kinds of things. I know in my own family, you know, my husband has struggled a little bit with his weight, and finally he announced to me that he was just going to grow taller. So, University of Chicago, sorry, but so we also have to look at messages. And you know, I want to actually say something nice about McDonald's since I'm on this slide. You know, when I do a lot of field work, remember when I'm not in the dollar stores or stalking people with their carts, I sometimes stop at McDonald's because it's one of the few places that has what? If you ever know these neighborhoods, what do they have? Oh wow, they have a, you guys really aren't there. They have a public bathroom, okay? When you're in one of these deserts, and you, right, no, but and they have, actually they have free internet. And I wrote a blog recently for Phil Abundance. You should check out their blog site. And I was going to try to incorporate this into the blog, but it's too much. But I actually finished the blog while I was in DC doing field work and sent it off from a McDonald's because it was the place that I could do it. But so what an opportunity, right, to work with fast food. So we're not, you know, they figured it out. You know, sometimes I say fast, cheap, and easy. It's not a porn film. It's a new American diet. But you know, some of these places like McDonald's, I got a mango smoothie, and you know, I mean, then you know, when you do have some choice, you know, there's not a lot of choices, but you have some, you have to, that personal responsibility has to kick in, and sometimes it's hard. But I think we really need to look at the messages that we're sending people. Solutions. There's a lot of different solutions, and we'll, you know, hopefully we have a session later. I'm hoping that we'll continue the discussion. But just a couple to share. So one is just using data to drive where you make your and how you make your decisions. And more and more now with our reports, as a matter of course, with the report, we use all our block level data to identify, like in Ohio, in that county, we identified the top 10 locations, 5 in Cincinnati and 5 in the remainder of the county, where some kind of mainstream food solution would do the most potentially to impact health and food access. So that was one thing. We also looked at where if the current mainstream stores went away, where they would cause the most damage. And actually, in that study, before we published the report, one of the stores that we identified went out of business. So that's kind of case in point. But right, if you only have, if you're planning people, and you guys should be working with your city planning department, if they're working with some of these stores on retention, to identify which ones need the most help, right? Let data drive your time and resources. And then identifying which stores that are fringe would do the most to cross over from fringe to mainstream. And we actually have a scale from 1 to 10, where 10 would be the most mainstream and 1 would be the most fringe, and kind of identifying where stores are at. Not everybody's going to be a 10. And then, of course, once you have that store right, price is a factor. There's other kinds of things, hours of operation. But with corner store development, we really recommend that you identify the top impact stores, and really focus on those, and then also use the SNAP program. Say, hey, if you want to be in SNAP, because if you have 47 stores in Chester, you can say, hey, we're not putting you out of business, but if you want to be part of the first line of defense, you have to sell certain kinds of things and then help them step up. I'm just making up a number. Let's say 5 do. If 5 do and the rest don't, hey, you've got 5 better stores.